Boa noite. Meu nome é Andrea Campagnolo, eu sou otorrinolaringologista e pesquisadora da UERJ, e hoje é a quarta-feira internacional da Semana da Voz. Nós temos um convidado internacional muito especial. Especial porque ele é um grande estudioso da voz. É o professor Benninger. Ele é professor e chairman do Departamento de Otorrinolaringologia e Cabeça e Pescoço da Cleveland Clinic. Ele tem vários títulos, vários artigos e livros publicados sobre voz. Precisaria até uma live para falar sobre todo o currículo dele. Ele vai falar para nós sobre os cuidados da voz cantada. Nós temos aqui também a presença da doutora Natasha Braga. Ela é coordenadora do Serviço de Laringologia do Hospital Universitário da Universidade da Bahia, e o doutor André Duprat, que é professor assistente da pós-graduação da Faculdade de Ciências Médicas da Santa Casa de São Paulo. A doutora Natasha vai coordenar a discussão dessa live. Agora que todos foram apresentados, nós vamos dar início à aula do Dr. Benninger. Hello, Mike.
Hi, Andrea. Obrigado for the introduction and boa noite to everyone. I hope you will enjoy this. I'm going to give you a bit of an overview on care of the professional voice. I hope it's very light for you. I'm going to go fairly quickly. I have a lot of slides, not so much because I want to give a lot of material, but I want to give you a very broad overview of the topic. So here we go. So this is the Cleveland Clinic. If you look at this front scene here, it's all the Cleveland Clinic. This is Cleveland and Lake Erie, which is kind of like an ocean. The Rock and Roll Hall of Fame is in Cleveland, and any of you who enjoy rock and roll, you have to visit this. It's one of the best museums in the country. It's fabulous. Now, this is the Crow Building. My office is on the corner, right on the one side over here, and this is the I building in front of us. We have a big presence in Florida. We now own 4 hospitals in Florida, and we're expanding. We have a very large neurosciences presence in Las Vegas. Does anybody know this architect? This is the same guy that did the Guggenheim Museum, and that's our Ruvo Center in Frank Gehry in Las Vegas. We have executive health and orthopedics in Canada, in Toronto. This is Cleveland Clinic Abu Dhabi. It is a completely Cleveland Clinic run hospital, built $2.5 billion. And this is our newest entry. We're finishing up construction of a facility in London. And right across the street, our neighbors are a bit noisy. It's like Buckingham Palace or someplace like that. So it's a lot of fun. And literally, we bring in people from all over the world. We have a number of fixed wing planes and helicopters and things, and we bring people from all over the world. They're all set up to be ICU, intensive care units, in these different flight opportunities. So let's talk about the professional voice or the performing voice. And really, the show must go on is one of the things that we have to think about. So one of the first things whenever we see a patient is think about, is this an opportunity to make sure that the show goes on? I'm going to start with this.
What if you had no voice at all?
Can you hear that?
Couldn't speak, couldn't sing, couldn't shout or sob.
The voice is the expression of the human mind and soul. It's our means of telling people what we want and where we've been and what we're going to do.
Well, you know you make me wanna kick my heels up and throw my hands up and throw my head back and come on now.
It may reveal aspects of health, age, emotion, and mood.
If we get lost, we cry for help. If we're hungry, we utter sounds.
It gives us the power of speech, the gift of song. Yeah, it can calm, it can anger, it can soothe. It's the most expressive instrument in the world.
We could turn jails into museums and build schools again.
The history of the world is all expressed through the voice. The production of speech and sound is probably what took us from Cro-Magnon man to advanced civilization.
I still remember when you used to be 9 years old. I was a fool for you from the bottom of my soul. Yeah.
There has to be contact between the vocal folds. Just like in a hand clap, I can go back and forth and you hear nothing. But the minute I...
Now that you're grown enough and old enough to know, yeah, you wanna leave me, you wanna let me go.
Well, the entire muscular and skeletal system play a role in voice production. The voice is a very flexible thing, and in order to be flexible, you have to be loose. It's not dissimilar to a dancer who stretches before they dance, or a runner who does a warm-up lap before they run.
I want you to know.
For those who have muscle weakness or some neurological deficits, flexibility is important. But what else do we know?
When we think of voice in particular, we think of how closely it reflects emotion. We think of babies and crying.
I think that the voice can reveal the inner human, that which is unique in all of us.
So that was a thing we did for Discovery Channel a number of years ago. You notice the hair was still red then rather than strawberry gray. And that was Ingo Tietze, one of the world's great voice scientists, and Lori Ramig, who helped develop the Lee Silberman technique for Parkinson's disease. But it gives kind of an overview. What does it mean? And really what we're talking about here is really anyone that uses their voice for a living. And that could be, we think of singers right away and actors, but public speakers, politicians, clergy, business people, teachers, and many, many more. The good news is that in all of these people, the drive that resulted in injury gets them to want to get back to performing. But the bad news is many have no formal training. Not all performance arts educators are knowledgeable about injury and prevention. And injury usually occurs at the most inopportune time, before that major performance, because they're working so hard to get there. And that's when we come in. So just a little background on vocal production. I think you all know this, but it's good to put it in perspective that the singer or the vocalist is comfortable with. So really it's like a musical instrument. You have something that activates the sound, which is the lungs. You have something that vibrates like the string or the reed, which are the vocal folds. And then you have the resonator, which is kind of the upper and lower respiratory tracts. And I'm going to spend a lot of time talking about that because that's more important than people make it out to be. It's also an interaction of a lot of different things. The diaphragm, the musculoskeletal system, the psychoneurological system, all play a role in the production of our voice. To realize we have over 400 muscles in the body, and all of them in some way help to produce voice. Just like in this guy doing his one, if he can concentrate on that noise, he can actually make his body that much stronger. But we really rely on this very small, little flexible instrument, which is our larynx. There are 22 internal and external laryngeal muscles, but really the ones we think about the most are the vocalis muscle, the medial and lateral bellies, which really kind of shortens the vocal fold. There's some evidence that belters or musical theater people or gospel people primarily use the thyroarytenoid muscle, the vocalis muscle, for the production of voice. At the same time, the cricothyroid muscle elongates the vocal fold, intenses it, and elevates pitch. And it has both adductory and abductory fiber activity. So if you're breathing and you lengthen the vocal fold, you have a bigger airway. So the cricothyroid can activate during abduction. Classical singers primarily use their cricothyroid muscles to actually produce sound. And it's the balance of these two that gives the beauty of the sound. I think all of us know Hirano, who developed the body muscle theory related to the vocal folds, very well established that there's a superficial epithelium. By the way, can you see my pointer? Or no? Okay. And then under that is the deep layer of the lamina propria and then the vocalis muscle. And why is that important? It's important in part because injury tends to occur in singers very superficially. This is some work by Gerhard Friedrich. And if you actually look at the male figure here on the left, that between the epithelium and the deep layer of lamina propria is only 0.14 millimeters. That's a very, very small space. When it swells, it's a little bit bigger, but it's important, and particularly when we get to talking about vocal fold surgery. The way the vocal folds vibrate is they actually have a lower contact surface and an upper contact surface. And if we look at most injury in vocalists actually occur on this lower contact surface and not on the upper contact surface. And that's also important from the surgical management. I think we all know the myoelastic aerodynamic theory of phonation, which where we bring the vocal folds together, we increase our subglottic pressure that opens up the vocal folds from below upward. And when it does that, the air is released, and then the Bernoulli effect sucks the vocal fold back together. And that's one of the reasons that our muscles only contract 12 to 15 times a second. And yet at the same time, we can vibrate 1,024 or higher cycles per second. So how do we evaluate the vocalist? History is critical because 90% of the time, you're going to have a good impression of what the issue is based on the history alone. Then we do subjective assessment and quality of the voice. So you have to have a good ear and you have to start listening to people and listening to voices. And I would recommend that you become very familiar with multiple different music styles because you're going to come across people from different music styles. Stroboscopy and high-speed video, outcomes instruments such as the voice handicap index or the singing voice handicap index. I was involved in the development of the first voice handicap index. Some airflow analysis, and then we can do objective voice evaluation. And I'll show you later that we actually have a recording studio in our clinic. So many times we get the singers to go in and sing, and then we have them come back out and reevaluate them. High speed is really very interesting. So here on the left, you can see a normal vocal fold in high speed where we're seeing every vibration. On the right, you can see the asymmetry of the vocal fold vibration that we really couldn't see on stroboscopy in this person, and this was valuable for that. So what affects pitch? So we increase pitch by decreasing the cross-sectional mass, therefore, smaller larynx in a woman or a child, increasing vocal tension or increasing subglottic pressure. And we decrease pitch by increasing the cross-sectional mass. A man, a smoker, Ranke's edema, all will decrease pitch for people. And this is some work we did back in 2002, where we actually measured vocal fold length at different pitches. And you can see that as you elevate the pitch, you elongate the vocal folds. Another thing to remember is there's a lot of overlap in singing style. So if you look at here, if you look at the basso or the bass, I mean, they can get up to 350, 400 cycles per second. And yet the soprano or the mezzo-soprano can get well below that. So it's important to realize that the voice has a lot of range. And oftentimes what we find is people are fixed in a range that's not quite them. So Caruso once said that God must have loved the soprano. God must have loved the mezzo-soprano and the baritone, because he made so many of them. And yet we see everybody wants to be a soprano or coloratura, and everybody wants to be a tenor or a lyric tenor. And a lot of them will never be able to perform there. So one of the first things I do is if they have no formal training, I get them evaluated by somebody that can evaluate their range. Remember the supraglottic vocal tract. It's absolutely critical. It's really how resonation occurs is at the level of the vocal tract. And I'll show this in a very clinical way. So this was part of that Discovery Channel program that we did. So listen to this carefully.
If you were to hear the sound of our larynx without the rest of the vocal tract, it would sound kind of not like what we're used to hearing.
Where shall I go? What shall I do?
So if anybody's familiar with Gone with the Wind, it doesn't work very well, does it? But really, that's all our vocal folds do. They just buzz. They're a buzzing sound, okay? It's like taking a piano string without a piano and just plucking it. It creates a buzzing sound. So everything else is depending on these resonating cavities. And critically in singers, there's a whole concept of formants. And I don't want to go into a huge amount of detail on formants because it's very kind of intensive from a scientific standpoint. But as sound passes through a resonating cavity, there's a profile of spectrum changes that allows a very specific sound, and it reinforces very specific partials of the vibration of the vocal fold. And these energy points are formants. The singers know this. So these are singer formants. So for a bass, it's 2,400 cycles per second. For a soprano, it's 3,200 cycles per second. Now, they can't produce 3,200 cycles per second with their larynx. What's happening is that's being produced in the back of their pharynx by how there's resonation in the back of their pharynx. So pharyngeal problems can be critically important for singers. Nasal problems can be very critically important for singers. And we really need to be careful about doing nasal or pharyngeal or tonsil surgery on singers unless we're pretty sure that they need it. I want you to hear this next thing. Okay, we were on safari, and I'm 35 meters away from this lion. Not that loud, yet that sound in that environment, because of the resonating qualities of the lion's pharynx, could be heard for 5 kilometers in any direction. So a lot of it depends on the hall and those kind of things. You know, loudness is a little bit difficult. Oftentimes an untrained singer tries to increase loudness. They also increase fundamental frequency and intensity and can cause injury. So training becomes very important for them. What about the lungs? Well, you know, the lungs are obviously you can't produce sound without the lungs. But there's pretty good evidence that in really good singers, lung vital capacity is very important. So the difference between a trained and untrained singer is often increased respiratory efficiency. The difference between a good and great singer may not only be pulmonary efficiency, but in some cases, total lung capacity. Luciano Pavarotti had the largest lung capacity of any singer that Ingo Tizzo ever measured, okay? And that may be why he had such an unbelievable voice. And we also have to remember that our vocal folds are important for lifting and for you name it. So when people are dancing, their vocal folds are coming together multiple times, even when they're not singing. This is a fascinating guy. So this was our Abu Dhabi group. He is, at that time, was the world deep sea free dive champion. And what he was just doing there is he was using his larynx as a valve, and he was sucking in air to expand his lungs, okay, so that he would have a massive expansion of his lungs. And he could actually exhale for 30 or 40 seconds with full exhale because he would put so much air in his lungs. So our vocal folds also work as a valve. So we have singers that think of this resonating as chest register, kind of a deeper pitch from their voice, head register, which is kind of a heavier pitch, a lighter pitch from the pharynx and sinuses and you name it, but it's hard to measure that. That's something that they just feel. They feel these registers. They feel that resonation in those portions of the body. And you'll see difference in resonation here.
With my voice, I can do anything. With my voice, with my voice, with my voice.
So you can see that difference in resonation. Now we're going to see the difference in resonation looking at 4 vocal folds at the same time. It's great, isn't it? This is on YouTube. You can pull this down on YouTube. It's called chords. But you can't really tell much of a difference looking at those larynges as to who would be the bass and who would be the tenor and who would be the baritone. But it's clear that this is happening in the entire resonating cavity. And look at this one. Look how much movement there is at the base of the tongue and the mobile tongue and the palate. This is a functional MRI. It's great, isn't it? So remember, the voice is not just what we hear, it's what we expect to hear. So Darth Vader, if he didn't sound like that, we would be terrible. Or R2-D2, the same thing.
R2-D2, where are you?
So it has to be pleasing quality, you know, a proper balance of oral and nasal, appropriate loudness, fundamental frequency for age, size, and sex. If I talk like this the whole time, you would probably think that's a weird voice. Appropriate inflections. If I talk like this all the time, you would be bored to tears in 3 seconds. And consistent with cultural and dialect changes because they're different for each group. So I'm going to play a couple different voices here. Both of them clearly are sopranos. So this is one of the Peking opera famous singers. I've known her for many, many years. But this is the chorus, kind of classic, almost European opera. Very twangy. It's not typically what we would hear in European opera. And then at this time, one of the famous opera singers of all times. Very, very different. And this woman here from China is arguably the best known singer in the world. There's 2.5 billion people that know her very well, or 1.5 billion people. So it's really important to put that in perspective as we're treating people. Every one of these voices are different, and their style of music is different. And really, it's incumbent on us in not only understanding what their voice can do, but what do they need to do with their voice to be a performer. And then remember, these are truly vocal athletes. And I'm going to run through this because it's kind of interesting.
In days, a glimpse of stocking was looked on as something shocking, but now God knows anything goes. Good authors too, who once knew better words, now only use 4-letter words, writing.
Okay, now she's now going to do 5 minutes of heavy tap. Okay, and I'm going to stop in a couple of different places. Remember, the chorus line is doing everything she's doing. Five minutes. So they still have to sing, right? They just dance. She's recovering. And this is why. Can you imagine doing that after 5 minutes? So she actually took time to recover in order to do that huge note at the end there. But this is taxing on these people. And I think people that do song and dance are more taxed than the singers alone. Another thing to remember is our vocabulary is different than the performers. and things that we say bother them, don't ever tell them that they have nodules because they get panicked. Tell them they have nodular swelling or a little bit of swelling. And similarly, if you're going to treat singers, you have to be able to speak singers' terms. What is a crescendo? What is a diminuendo? When they say I'm having trouble in my passaggio, you need to know what that means in order for them, number one, to respect you, and for you to look at that various parts of their voice and make a determination. So the chief complaint could be a number of different things. And many times, again, with the chief complaint, we can actually have a good impression of what the problem is. If they're hoarse, it could be laryngitis or reflux or edema. Fatigue is often or overuse. Breathiness is usually something more dramatic. Edema, vocal fold hemorrhage, etc. The need for prolonged warm-up may be reflux, and bam, bam, bam. So the point is that if you pay close attention to what they tell you, you can often have a clue as to what you're going to see. And if you don't see anything, you have a clue for what you're going to treat. The three things we see the most are overuse, misuse, and abuse. Overuse is using it too much. Misusing is using it without being educated on how to use the voice appropriately with good training. And abuse is screaming, yelling, smoking, and all those other things that come into play. So the causes of overuse, particularly in singers, are time and duration of practice. Find how much they practice. Particularly people that are coming into a new role tend to over-practice. They think by practicing more and more and more that they're going to be better and better and better, and what they're actually doing is causing injury. So they have to practice not more, but they have to practice smart. Excessive performing. The musical theater is a classic example. They perform Tuesday, Wednesday, Thursday, Friday, 2 on Saturday, 2 on Sunday. They're off Monday and they're back to Tuesday, Wednesday, Thursday, Friday the next week. Conducting and teaching, activities unrelated to performance. We were talking earlier, we all have kids at home. Well, I don't have it at home anymore, but you're using your voice all the day with your family and your friends, etc. And the environment of the performance. Abuse is really shouting, throat clearing, smoking, singing, talking over excessive noise, singing and talking under tension. There are a lot of environments that singers have to be really careful. And if I don't get to them soon, I'll come back to them. Oh, here it is, airline travel. So, many of them are very, very well trained in relationship to their singing voice, but they're not well trained in relationship to their speaking voice. They don't use amplification when they could. So they have that expert training is lost and ignored in their speaking voice. Telephone sound amplification, airplanes are the worst. You're talking over ambient noise, so there's the Lombard effect. It's very, very dry. And so I tell people, don't talk on an airplane unless they have to. Make sure they stay well hydrated. And don't drink alcohol on an airplane. The things we see in relationship to singing, these are questions I would ask them. What do they do for warm-up? How do they work through injury? What is their rehearsing environment like? Do they have adequate training in general or for particular roles? So if you actually see the singing teachers, many of them teach technique, but many of them teach a role. There's a certain way to play anything goes. Okay, there's an expectation of what that character will do, and they really need to have both. Often it can be the same person, but they need to have both. Airs and technique is probably the biggest thing we see. People come in and say, I get to hear my pitch break, and what I tend to do is when I examine them with stroboscopy, I have them go ahead and just do standard stroboscopic examination. Then I have them try to match the area that they have the most trouble. And then I start them in a low pitch and I run them through an entire series of scales. So I have them go hee 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 and hold it so I can see the E, and then hee 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 so I can see the E. And I go all the way up to the upper portion of their range and see if they start to break at different portions in their pitch. Lots of things in the environment affect our voices. Humidity and dryness, dust and dirt, set construction, secondhand smoke. We hope that there's not much primary smoke, but the big problem now in the United States with legalization of marijuana in many states is we're now seeing a lot of people with marijuana-induced laryngeal irritation and dryness and injury. Pollution, travel, other vocal irritants are all very important. Smoking, plain and simple, it's a no-no. If you're a singer, you can't smoke. I had a very famous rap singer who came into me when he was relatively young, and he was smoking a pack of cigarettes a day and drinking a fifth of vodka every day. And I and Doug Hicks, who was our speech therapist at the time, we read him the Riot Act, and we said, listen, you're not going to survive like this. He's now won 7 Grammys, okay? I mean, the guy is a superstar, but he's rechanged his whole life to advance his career. Don't forget muscle tension plays a big role. If you see scalloping along the edge of the tongue like this, you can assume that there's a lot of jaw and neck and muscle tension. And temporomandibular joint dysfunction, which is a big problem for many people. They're clenching their teeth, which tightens the entire strap muscles and elevates the larynx and doesn't allow the flexibility of the larynx to go up and down in the neck. It also narrows the thyrohyoid space, which many of the speech people who are probably here in the audience, one of the things they do is thyrohyoid release. Pull it back down, relax that in order to make it better. Endocrine dysfunction, I would say be very careful starting birth control pills before a major audition or performance. You should probably be comfortable with them before you do, because it can have subtle changes in the voice, and let alone premenstrual syndrome. You poor women that have to do everything during your menses. I mean, the guys don't get it, but when you see people that come in, you see that many of them have decreased efficiency, loss of the upper range, let alone headache, and some other things that occur with premenstrual syndrome. I will tell you, every now and then I will see a woman that I'll see increased vascularity of the vocal fold and they hadn't really abused their voice. And I'll say to them, are you about to go get on your period? And they'll say, yes, I am. How do you know? So some actually have this increased vascularity with their menses. Upper respiratory tract infections, by far the most reason we see performers acutely. They have a cough, they have a change of voice, they try to compensate for it, etc. And it really is important for us to try to understand how big an impact that's going to be on their performance. The things I do is avoid excessive coughing or throat clearing, voice rest, relative voice rest, increased hydration and mucolytics or humidification, amplification, antibiotics. I try not to use much unless it's truly acute bacterial sinusitis meeting the 10-day criteria, because sometimes the antibiotics make them feel worse. So amoxicillin and clavulanic acid cause diarrhea in some people. Not a very good thing to happen if you're going to have to dance this evening. I would avoid the first generation antihistamines. Echinacea, golden seal, those things may be helpful. I'll get to steroids in a minute here, but I think one of the things we want to think about is whether or not we're going to use steroids. And when do we cancel performance? If they have severe symptoms and a fever, they probably shouldn't go on, let alone they're contagious to everybody else. When we see somebody that has laryngitis, one of the things we want to do is we want to distinguish between an acute condition and a chronic condition. Laryngitis itself is not necessarily a contraindication to singing. And in fact, some people will have a raspy speaking voice and will have a very good singing voice. So a lot of this is kind of how we evaluate them in the office. Musculoskeletal system. Many people come to me and say, listen, I have to have abdominal surgery or leg surgery. What should I do? I have an upcoming performance. And I really feel that if they can't control their musculoskeletal system, they probably should delay the performance. So for an abdominal surgery, they should be able to do 10 sit-ups, for example. And for leg surgery, if they're able to sit through the performance, which isn't easy, that's fine. But if they have to stand, they need to be able to stand for long enough to do it. Diet and weight. This is maybe the biggest problem I see in performers is bad diet, inappropriate weight, poor conditioning. It is a holistic issue, and they really need to look at it holistically. So kind of a well-balanced of carbs and fats and proteins, cautious dietary supplements, a low-acid diet would be helpful. Many of our performers have trouble with specific things, caffeine or spicy foods. Milk and dairy products are really difficult for some people, particularly just before a performance, because it thickens the saliva. So all these things are things that I may have a discussion with a performer about. Reflux. Listen, for some people, reflux is the be-all, end-all. By the way, I actually found this hot sauce in Louisiana. It's from South Carolina, but I found it in Louisiana. It's called larynx lava. And this stuff was hot. But really, we want to look at a dietary way to control reflux and only use medications when we need to. These chronic throat clearers, they've got the sinus problem. Those are almost for sure reflux. 90% of the time, they're either allergy or reflux. This is a book I picked up, 1892, from Germany, A Color Atlas of Laryngology. And you see this thickening in the posterior or interrhythmic space that's probably reflux. So I start with diet, weight loss, elevating the head of the bed, laying on the left side, low acid diet, maybe antacids, and then I move on to other medications. So all of these things play a significant role in reducing reflux. And in most cases, we can control them by just doing this. A big thing for many of the performers is they like to eat before they go to bed because they've performed in the evening. And then they have a big pasta dinner and 2 glasses of wine, right? So it's being cautious with that. Just one thing, do you know that white wine is a much higher acidity than red wine? In fact, of all the alcohols, white wine is the worst. So make sure they don't drink white wine. And the best thing for them to drink is straight vodka with a slice of cucumber in it, because the cucumber actually absorbs the acidity. So if they're going to drink, vodka with a cucumber. And then, of course, we have medications that we use, and it varies depending on the person how we're going to use those. What about a vocal fold hemorrhage? They happen, and it really is something we have to be cautious with. It's not absolutely as bad as we used to think. Lucian Sulika has followed a bunch of people with vocal fold hemorrhage, and most of them end up doing very, very well. Often associated with an upper respiratory tract infection. You want to make sure they're not on aspirin or non-steroidal anti-inflammatory agents. So this is actually my son. He had a vocal fold hemorrhage playing American football, and his voice was very hoarse, and we kept him quiet for a short time. But really, in most cases, if there's an acute hemorrhage like this, we don't want them to sing, okay? We want to put them out long enough to avoid progression. I'll show you in a couple slides why. So this is a Metropolitan Opera star. 2 weeks prior to opening night, he flew out to see me. He had a clear hemorrhage. We put him on some steroids, which is questionable, and voice rest, and I kept seeing him back. And 4 days before the performance, he was ready to get back on the stage. So the rest and all those things made a difference. But this is what can happen if they don't. So this is a hemorrhagic polyp. If you let you to end into a hemorrhagic polyp. I actually have one person where I actually had to drain a progressive hematoma in the larynx. So this is one of those, probably should cancel a performance if you see a vocal hemorrhage. Another thing to remember is confidentiality. You know, everybody wants to know what's happening with X, Y, and Z. The pictures that I show you are on my wall. I can't tell you if I ever treat anybody, okay? And so later when I show you our clinic, but I can tell you that those people gave me pictures. The one thing you remember is this is the patient's information. It's not the managers, it's not the tour company, it's not the theater or the venue. And if they don't tell you that they want you to give them that information, you don't. I had one famous person come in and film a documentary when she was in my office, and they didn't ask me if I wanted to be in the documentary. So I told them they can't film unless they get my release to be in the documentary. Allergies are important. What I do is if I'm unsure about the allergies, I get immunocap allergy testing, specific IgE testing, and then I make decisions about allergy treatment based on that. But it can be pretty devastating to people that have very bad allergies. Age, little kids, you know, this Annie syndrome, trying to get all these kids to perform at this high level. And particularly in this puberty danger range, and particularly for boys, you have to be very, very careful about having them use their voice. And in many cases in Europe, for example, they don't have them sing it during that puberty time. And then on the other end, you got the aging voice. And a lot of things happens with the aging voice. And if you notice, females tend to be affected more significantly than men. And most people that are able to maintain their voice very, very well going late into their life, most of this it's easier in a man, but doable in a woman. So we really want to focus on technique. We want to focus on stage presence. We want to focus on their material. Performance anxiety. See a lot of performance anxiety. Maria Callas used to walk in the middle of the street hoping to get hit by a car on her way to the Metropolitan Opera. It's awesome when you see that. Carol Burnett, do you guys know Carol Burnett? Ever seen the Carol Burnett show? Fabulous, hilarious show. She would always seem to jump out on stage. They really had to push her on stage because she had such terrible stage fright. And there's lots of treatments, but it's important to work with a very knowledgeable person who understands performance anxiety. Drugs and medications, you know, we've kind of alluded to these all the way through. A lot of people are using beta blockers for performance anxiety. They should be cautious with that because it tends to flatten the performance and it makes it difficult for people that are doing dance. And be careful with alternative medicines. So these are things that increase the risk of bleeding. So you see people that are on high dose ginkgo and things, it's probably not a good idea to do that. Canceling performance really depends on the importance of the performance. It's a decision that's made together with you and the performer. I think there's things that are automatic, worsening inflammation, fever, risk of hemorrhage, but the rest of it is negotiated based on the importance of the performance, the quality of their voice, and how they think they're going to do. A lot of general stuff we use, mucolytics, hydration, humidification, massage, particularly for the dancers, resting. I recommend to singers that they cool down, just like a runner cools down after they run, because that seems to help, and some homeopathic treatments, and then removal of the bad stuff. We are a multidisciplinary team, so voice instruction and speech therapy and education are critical. I don't use much steroids. I think overuse, now steroids are going to work for that acute setting, that one time that you need to get somebody out there. But I tend to see way too many people that have been on steroids in every city they go to, and they rely on steroids to get through performances. Most of our voice rest tends to be relative voice rest. Use your voice less, and don't use it intensely, try to change your material, those kind of things. It tends not to be complete voice rest, except for in the face of a hemorrhage. Just a quick thing on office-based procedures, we're doing so much more. We're able to see things so much better. We understand the pathophysiology so much better. Our microsurgical techniques are better. We can use injections and lasers now in the office. So we can inject fillers or we can inject steroids. And where we inject is really important. We can inject more laterally or we can inject more medially. So I did 2 injections today. One was a filler and the other was superficial steroid injections in a singer. And here's a simple, I mean, it's relatively simple to do these injections. Here's some steroids that I'm injecting into somebody that's had recurrent problems. And this is a study that showed that injecting steroids in the office can actually make nodules go away, for example. Lasers. This is a person that had a little patch of leukoplakia, just to show you how we do it in the office. The next person is more illustrative. Had these big vascular lesions on the vocal fold. We had her, she's a big time Las Vegas performer. Many of you may actually know. And she would actually have worsening the more she would sing. Get an office laser. This is what it looks like 2 weeks later.
Again,
And in 4 weeks, she was back to performing. So I have about 8 or 10 more slides. These will be very quick. This is kind of the promotional part. There are really good books out there on care of the performing vocalist. Very good authors. I don't know who they are, but they must be good. That was the second book ever written on performing voice. Bob Sadeloff did the first one. Tom Murray and I did a couple together, and then we did one recently with Mike Johns. We actually work as part of a big voice team at the Cleveland Clinic in our voice center. We have collaborations with many groups around the country, Yamaha Music, Rock and Roll Hall of Fame, film commissions, etc. So create those relationships. They are really important. We see people at the theater. We have 5 laryngologists, and we're hiring a 6th. We have a laryngology fellow. We have 4 of our speech people that do pure voice and 12 others that do swallowing. And we can coordinate these with 2 centers. The Cleveland Clinic Medical Center for the Performing Artist, and basically this is orthopedics, and it's for dance, it's for instrumentalists, etc. And then the Arts and Med, we were one of the first centers in the country. We've been there for over 40 years. We've been coordinating care at the Cleveland Clinic. I haven't been. And then we have the Arts and Medicine Institute, where we actually use the arts to heal patients that are sick. So we work closely with those groups also. Our voice center, make it look good. Make it feel comfortable for people. Show the pictures on the wall that people show you. Have a place for them to sit where they're away from the other patients. It really is very important. Put out magazines like Opera News or Stage Bill or things for them to read while they're there. Like I told you, we have a full recording studio in the clinic. We use this both for recordings and to allow people to practice or warm up, or for instrumentalists. We actually do streaming for a number of patients around the country, where we can actually do piano and streaming singing at the same time. And I'm going to finish. This is my last few slides. This isn't new. I've been a former president of the American Laryngological Association. In 1887, they had a whole program on care of the laryngitis in performers. And you just look at all the things they gave people. And I'll read a couple to you. For habitual inhalation, turpentine, terbinafine, and eucalyptol are good. Sometimes I advise people to put turpentine on the carpet at the bedside so that they can inhale the vapor during the night. Doesn't sound very good to me. For a professional who's compelled to attend a performance that night, one method that I find best is to administer a sharp emetic and have them vomit, which is horrible. But these are things that they did back then. And they used cocaine directly on the vocal folds. They would spray cocaine on the vocal folds to decrease vascularity. But it doesn't seem to bring tone back to the vocal folds. This guy basically ran the meeting, and he finished with this. I have had these professional vocalists under my care, and I found that no matter how much zinc is used or how much turpentine is sprinkled upon the carpet, if they do not rest their vocal organs, the hoarseness will continue. In 125 years, people are going to look at my lecture and say, what an idiot. He doesn't know anything. But just remember, it's an evolving field. And I'll finish with this from Seneca and these wonderful children. I particularly like this guy on the left that's so intense looking at his music. So with that, that's the end of my presentation, and thank you very much. You're muted, Natasha.
Natasha, you're muted, Natasha. Good.
Boa noite a todos, obrigada por estar nos assistindo. Eu sou Natasha Braga e gostaria de agradecer a BNV e a Aula pelo convite. Professor Benninger, first of all, congratulations for your brilliant presentation. We'd like to tell that you are always very welcome in Brazil. The gift of being objective, assertive, and in your lectures you play with art, humility, and simplicity. It's a great honor that you accept our invitation in the name of the Brazilian Academy of Laryngology and Voice and the Brazilian Association of Otolaryngology. We'd like to say thank you very much. You make the difference, spreading your giant knowledge all around the world. And because of that, we can assure that your guidelines are famous worldwide. Então, como vocês viram, né, o professor Benninger, ele foi extremamente completo. Ele começou falando detalhes de fisiologia, depois ele falou sobre a importância de treinar o ouvido, da análise perceptiva aditiva, que é muito importante para você ter uma acurácia no seu diagnóstico, usar o VHI, um índice, para ver o impacto do seu problema da voz na sua qualidade de vida, no seu trabalho, a diferença do cantor de elite para um cantor popular, né? Quando o cantor de elite usa muito mais na capacidade pulmonar, e ele aumenta menos, né? Faz menos o uso de agudo para aumentar o volume. Isso é um erro muito comum no canto popular, deve ser treinado. Destacou também o desafio duplo, o que é cantar e dançar. Então, nós no Brasil temos muitos shows, né? Então, em São Paulo tem muitos shows da Broadway, em Salvador, na Bahia, nós temos muitos cantores que pulam, né, e gritam, e cantam, e dançam no trio elétrico, e isso é uma coisa muito importante. A importância do efeito dos medicamentos na voz. Então, você vê que até os anticoncepcionais são prejudiciais dos cantores de elite. Então, a importância da gente perguntar a respeito disso, valorizar o uso errôneo, né, e o uso inapropriado dessas medicações. Inclusive, ele citou que muitos fitoterápicos aumentam a chance de hemorragia. Então, imagine que muitas pessoas usam fitoterápicos e vão à performance sem saber que aquilo ali pode aumentar a chance de hemorragia. Falou sobre disfonia, tensão muscular, refluxo, medicamentos, enfim, ele deu um apanhado geral de tudo que a gente precisaria saber, né, a respeito da laringologia e voz. Então, realmente foi uma aula extremamente completa. E agora eu gostaria de convidar o professor André Duprat, que é o professor assistente da pós-graduação da Faculdade de Ciências Médicas da Santa Casa de São Paulo, para comentar e fazer alguma pergunta para o professor Benninger. Professor André, por favor.
Hi, Natasha. Right. So I'd like to thank for the kind invitation to be a commenter here at this outstanding lecture. It's an honor to be here alongside you, Mike, and my Brazilian colleagues, celebrating the World Voice Day. Mike, I'd like to do a question talking about COVID-19. So the COVID pandemic affected the singer's life a lot, and they are no longer performing, so they are less exposed to vocal abuse or overuse of the voice. Have you noticed changes in the characteristics of the vocal fold, like lesions, ectasia, vascular ectasia, or chronic laryngitis? Because I start to think that they're really changing the vocal fold structure, improving the vocal structure because of the vocal rest. What do you think about this? Have you noticed this or not?
Yeah, so it's very interesting. By the way, you're all welcome in Cleveland too. So if you want to come up and visit, we love to have people visit us. And I'm to comment as you have, this World Voice Day actually started in Brazil, and it has now become such an international phenomenon. And we really thank all of you and your hard work in Brazil and in making this a worldwide reality for us. Yeah, I'm not seeing the performance like I used to. It's much less than we did before. And again, because number one, the theaters aren't open, the concert venues aren't open. We have a fabulous orchestra where they're only doing things virtually, etc. But one of the things, and so yes, so number one, we're not. Number two, as they did before, particularly with the more aggressive music styles, such as rap or rock, where it's much more aggressive. The thing I am seeing though is we're seeing more substance abuse. People are smoking more. The singers that were smokers, they're smoking more. They're drinking more alcohol. And so we're seeing different kinds of problems. We're not seeing the polyp. We're seeing more of the chronic laryngitis, the irritative type thing. And I think it's going to be a while before we get back to homeostasis, where the performers realize, I've got to get back to my old lifestyle. And I really need to start practicing and training and doing all those things again in order to be on the road. But for me, a lot of my patients are international patients. They're not coming at all. So I'm not even seeing any of the international patients. And even some of the customary people that come to us from all over the United States, rarely are coming to see us now. More of the singers we're seeing now are, college and high school students or people that are in a local band, those kind of things. We're not seeing the big time performers. I think we're going to see a shift, and I just hope that people don't go from doing nothing to doing a lot in a very short time and risking injury that way.
Oh, for sure. And regarding this situation, do you believe that different voices, singer style, like rock singer or belting singer, has different kind of lesion, the vocal folds? The vocal folds are different, thinking about phonotraumatic lesions, or does like everybody have polyps, or much more the rock singer? What do you think about?
I tell you, I rarely see a polyp or a hemorrhage or even a cyst in a classical singer. I tend to see more kind of nodules and chronic irritative type things. In the really aggressive singers, and I know this is true in Brazil, that we see more cysts. So cysts are much more common in country music singers because of the way we think that they have some micro traumas with invagination of the epithelium. And in kind of the rock, pop, particularly rock or rap, we see more hemorrhagic type things, where it's acute, sudden, they just kept pushing through a performance, they had a hemorrhage, they develop a hemorrhagic polyp, or they develop a pseudocyst or something like that. Yeah, I do think there's probably a difference in the type of lesions we see based on the different performances. And I know Andrea and I did a paper together where we looked at a number of different lesions. And in fact, we don't see the number of cysts. When she first told me that she was seeing all these cysts, I'm saying, or sulci, I'm saying, we don't see this. And when I looked at them, in fact, they were the case. And it probably has to do with the speaking and singing style.
You have a lot of sulcus in this paper, no? Many sulcus cases.
Yeah, but I was shocked because I didn't believe her when she.
Big surprise for me, for sure. Thank you so much. Be good. Thank you for your answer. I would have much more questions, but
you know what? I'm going to look at that though. I've thought about that before, but what would be fun to do is retrospectively go back at all of the singers that we've operated on and look at the lesion, because then if we operate on them, we know exactly what they have. We're not speculating. And look at the lesion and then look at the style of music that they sing. It'd be fun.
I think that the sulcus could be just an edema, no? You have the sensation it's a sulcus, but something, the edema can like a pseudosulcus, something.
Yeah, and you don't know really until you're there.
For sure. Thank you so much for that.
What is very interesting here, sometimes we think that the classical singers have had time to deal with cysts, and sometimes they give up and they go to be a popular one. And here in Salvador, for example, they have many lesions because they were belters and they used to sing and dance at the same time. And they have cysts, they have polyps, they have sulcus. And this harshness doesn't, it's not so bad to hear because they interact with people and they can deal with that much better than with the classical singer. And so it's very common here. They have different legends, but they are popular. We have, most of them are popular ones. So I can imagine that you that great experience with classical singer, it's completely different from here.
Well, the other thing with the classical singers is they get rest. They perform on a Friday and Saturday night, and then they don't sing for the rest of the week. They practice and they rehearse and things, but they don't perform aggressively. I had a famous rock singer who was a drummer. And what we did to get him on stage was to get him off the drums. And so they brought in another drummer that played for him, and he actually stood in front of the microphone. So a lot of this is kind of what can you do? How do you negotiate? What do you do with the sound crew to augment their voice? how much to use the backup singers, what does their material look like. So in many of these really highly reputable performing artists, you really have to negotiate their performance. You know, you have to sit with them and figure out how you're going to get them through the performance.
Mm-hmm.
They are asking us how can we say sussurro in English is whisper.
Whisper.
Whoop, I missed that.
They are asking us a term that we use in Portuguese is sussurro. I think it's whisper, isn't it?
Whisper.
Whisper voice.
We actually wrote a paper on whispering and what happens to the configuration of the vocal fold when people whisper. And about 80% of people bring their vocal folds tightly together and create a frictional sound. And that's probably not a good thing to do when you're injured. But 20% of people whisper with their vocal folds wide apart and won't hurt them at all. So I would say before you make a strong conviction about whether somebody whispers in the recovery phase, it's worthwhile to actually do flexible examination of their vocal folds and see what they're doing with their configuration. What do you call it?
Sussurro.
Soco.
They asked if it could lead to dysphonia. So.
In some people it can. Yes.
And do you have any question, Andrea?
Yeah, if you have time, I would like to ask about reflux, how it's important to treat. I mean, some patients need medication like for a long time. Is it a problem? What do you think about that?
Well, you know, it's interesting. It's I always thought the prokinetic agents were the best way to treat reflux, and most of them have gone off the market. But I've become a little bit more of a conservative reflux treater. I'll treat them aggressively with proton pump inhibitors and H2 blockers initially, but I really rely on diet, you know, lower acid diet, weight control, proper timing of food, smaller meals, body position, those kind of things more and more and more as I've gotten older, in part because we are starting to see some of the complication of long-term proton pump inhibitor therapy. There's now evidence that it predisposes people for infections. That was just presented at the American Laryngological Association meeting last week. So there's growing evidence that long-term acid suppression may not be good for people. I also put them on probiotics because I think long-term acid suppression probably changes the lower gut flora. And so I recommend that they take probiotics when they're with it. It varies from person to person, but lifestyle probably more importantly than medications.
Thank you.
We are running late. I'd like to know if Professor André has more questions.
I'd love to do another question, actually. It's a good point that you talk about is the steroids used. In Brazil, it's very common to self-medication with corticosteroids because it's easy to buy here. So the singer arrive in our office already taking the steroids. There's a big problem, so it's important that we said that you have to take care with this kind of drug. And I'd like to know if you have a criteria when to use the corticosteroids. If you have an emergency, you have to sing in 2 days you use, or just in hematoma.
Yeah, I think we're all the same. I think we base it on a number of different factors: the severity of the inflammation, the quality of the voice, the importance of the performance. If this is your major audition to get into, like in New York, the Juilliard, which is the music school that everybody wants to go to, you want to make sure that they can get there. If this is, you know, a high school student that's going to sing in a rock band over the weekend, you're probably not going to be looking at steroids. I think steroids are something that can be definitely overused. There's risks related to steroids, but at the same time, it's the only thing we can do in some cases to get people on the stage. You have 10 hours or you have a day and they have inflammation, they had a cold, and they clearly aren't at that level to perform. So if it's used judiciously, I use steroids. Normally I use oral steroids. Only when I go to the theater and it's like an hour do I use intramuscular steroids, but I tend to use oral steroids.
And do you think that speech pathologist can help in this situation? In 10 hours that you have seen, what do you think a speech pathologist can help? Something?
You know,
Emergency.
it is a multidisciplinary approach to these patients, and it's critically important that you have knowledgeable voice singing pathologists. But there are certain things that they can and can't do. I think the speech pathologist role, sometimes I work with them just to have them confirm my thoughts, you know, to run it by them and say, what do you think? We're going to try this, X, Y, and Z. I think it's much more important. Their role is much more important when you have a longer period of time before the performance, where you have a couple weeks, where they can really work with them on speaking voice technique and environment and family and all these other things. Or if they have a chronic injury like a small cyst, or pseudocyst, or nodules, where clearly how they use their voice is going to influence what happens with that. So we're a team. I don't think any of our roles are more important than others, but the timing of our roles are different.
That's what we know here during Carnival. Sometimes they sing for 4, 5, 6, 7 hours, and it's very important to have somebody to do all the exercise, and they need to deal with time and intervals and voice rest, and then go back and forth, sing again, and then the back vocal starts. So it's very difficult, and they helps a lot. And may I have the last question that I'm not sure if it is so simple to answer, but it's something that I doubt many times. How do you decide to cancel a performance in a singer? What the factor that you consider that are relevant for you to cancel a performance?
I missed the question. Say it again.
When do you cancel a performance?
Yeah, again, that's one of those things. By the way, I absolutely agree that the speech pathologists and the singing teachers are critically important in those people that are really, really intensively using their voice to not only be their guides, but to be their conscience, you know, and tell them, you know, this is what you need to do. You know, I don't cancel many performances because you don't normally have to. I think that with the combination of, a lot depends on time, of course, but with the combination of voice rest, of appropriate voice technique, looking at material, looking at the venue, maybe a short course of steroids or antibiotics if they need it, that for the most part, we can get people on to perform. The absolute indications for me are somebody that has a bad virus, you know, where they have a fever, they're coughing, you know, they're terribly congested, their voice is really bad. Those are people we don't necessarily want to treat with steroids. The other one would be a hemorrhage, I would be looking at canceling. And every one of the other cancellations is really based on a conversation that us, the speech pathologist, their singing coach, patient, the music venue, the manager, together, and we figure or not they can. But rarely do I cancel performances. I mean, I've canceled a few I have one that I canceled that was, the Lloyd's of London contract was $9 million on one performance that I canceled. And it took me 6 weeks of paperwork and I got paid nothing for it. So for the most part, they want to get on and we want to help them get on.
Great. We know that everybody had many other questions. Sorry that we couldn't answer all of them because we are running late. So we would like once more to thank Professor Benninger to teach us so many things about otolaryngology, and the professional voice care. We'd like to thank the Brazilian Brazilian Association of ENT for all the support during our National Voice campaign, Professor André Duprat and Andrea Campagnolo to help us with this live, and all the people that were on the YouTube, Renato and Adriana and Rui Mamur, that is our president. Thank you, everybody. And I would like to know if you have anything to say, André and Andrea. And I would like to thank you all for this live. Thank you very much, Dr. Professor Benninger. You were amazing, and every time we are very proud that you were always in touch with Brazil, and you were always accepting our invitation. Thank you very much for that.
If I ever move anywhere in the world, I'm moving to Brazil.
Great. Salvador, please. Bahia.
Congratulations, Dr. Ben. Thank you so much.
Thank you very much.
It's a great privilege, and happy World Voice Day, and let's keep all those people healthy.
Happy Voice Day for everybody. That's it.
Sure. We'd like to do an invitation to put to the person that translated everything for us, and he made a very high effort to do this. And so we'd like to show us his job. Can you do that now, Renato, please? Renato, are you listening to us? Oh, okay, starting. So those other people that helped us to do all this translation, that we know that it's not an easy thing. It's very hard to translate, mainly when we are using many technical words, and I am sure they did their best. Thank you very much for everybody that did made a hard effort to translate everything for us. Thank you, everybody, and thank you, Dr. Benninger, and good night for everybody.
Good night.
Good night. Thank you for having me.
So much.
Good night. Thank you very much.
Let's take a shot.